Hello, this is Chris from the Obstacle Doc, and today we're going to focus on ankle and toe mobility. Specifically, we're going to look at the 5-inch or 12.5 centimeter ankle mobility test. We're also going to look at toe extension mobility and how we can test that as well. And then we're going to put all that together, and we're going to show you a simple strategy that you can do that can kind of work on mobility for both at the same time. So down below here we have our tape measure lined up against a surface of a wall or an edge, something that we can use as a reference point. Danielle is going to be our foot model. To do this test, she is going to line up her big toe at the 5-inch line or the 12.5 centimeter line. This test can be done in standing or kneeling, half kneeling. Honestly, it depends on level of comfort for the client and getting in and out of these positions. But the main thing we want to think about is we want to make sure that everybody is standardized at their hips and pelvis. We don't want any leaning that would make the test look a little bit better than it actually should be. So from this metric here, Daniela is going to try to keep her front heel down as she leans her knee over her toes with the objective of trying to get the knee as close to the wall or edge as possible without the heel of the front leg coming off the ground. Again, what you want to look at for yourself is making sure you don't twist and turn at your hips or pelvis or arch your back to objectively make it look like you can do a better job. The clinical importance of this is it looks at how well the ankle can bend. When we think about stride characteristics for walking, running, or stairs, we want to make sure we have a sufficient amount of bend in the ankle in order to clear our knee over our toes for those objectives. This can definitely be limited in different cases of ankle sprains, ankle injuries, post-op ankle recovery, especially if you've been in a boot for a while, because the problem is this mechanism gets really stiff. Comparing both sides is a really good idea as well, because it gives you a chance to kind of see what one leg can do over the other. And again, specifically for walking and running with those types of reciprocal movements, when the ankle needs sufficient mobility across both sides, if one is lacking in one direction over the other or one leg over the other, that can show itself in the stride. As Daniela passes her knee over her toes, depending on how far she gets to, one question that you want to ask yourself is, where do you feel your restriction at? So if you try to bring your knee over your toes and you stop early and the heel starts to lift off, you want to bring that heel back down. If she starts to complain or report tightness in the back, that would allow us to try to appreciate that she may have soft tissue tightness in her calf, the mechanism of her Achilles kind of coming out from the muscle itself. In contrast, if she comes forward and she doesn't necessarily feel anything in the back, but she feels kind of like a pinch or tightness around the front rim, and it can extend all the way around from the inside to the outside of the ankle, that can actually be indicative of internal ankle joint stiffness. It's basically like the hinge is kind of running into itself, or like a rusty door hinge. So this can be important when we try to figure out why are we limited in this motion. The location of the stiffness or the tightness can kind of direct us into intervention strategies that we can do to try to get this closer to the edge. The variation of this test would be the following. Again, if we're measuring the right ankle, so her toe line is lined up at the 5-inch or the 12.5 centimeter. The off leg can kind of do what it wants to do. I usually have the client put it a little bit behind them, up on their toes. You don't have to balance on this. Again, you can have this hands on the wall, hands on the edge of a counter. The objective is to be stable as you do it. And then from here, she's going to bend the ankle, knee, and hip to come forward, keeping the heel down, going as far as you can without the pelvis or hip shifting or reaching to kind of make the test look better than it really should be. This can be a good alternative from the half kneeling, only because not every client can get up and down from the ground as easily. So if we're looking just to standardize this to ourselves, this is a great option. Again, comparing both sides. Okay, the next component we're going to look at in our total ankle and foot mobility appraisal is the big toe and the importance of big toe extension or dorsiflexion. And we're targeting this aspect here, the ability of the first knuckle or the first MTP to extend or dorsiflect. The importance of this, especially when thinking about the combination of the ankle mobility, is in the stride, again, whether I'm walking or running, is when I hit the ground and as I come through, as the ankle bends, so does the toe. So you need both elements in order to kind of have a nice smooth transition. This can be really important because if you lack extension or mobility here, it kind of jams and affects everything going up the chain. We see this a lot in our clients who have arthritic big toes, think of your bunions, or very specifically people who have bunion procedures to try to rectify that, but as a result end up developing stiffness in their hinge. So we really want to reestablish a necessary minimal amount of extension, as well as also pushing down so that that toe can function normally. So a quick way we can appraise this is the following. While Danielle is sitting, we're going to take a basic stick to line everything up. She's going to scoot her knees forward so that the knee is in line with the toes. That kind of standardizes a sufficient amount of ankle bend here in the back. That would be, again, relatively indicative of the amount of bend in a stride transfer. And as we're here, what I'm going to do is passively try to pull up her big toe for her. Now what I'm looking for, and this is a little bit of a guesstimation, but I'm trying to pull this up to at least 30, upwards of 45 degrees, or maybe halfway up. So if we think of the floor as 0, 90 is going to be straight up to the ceiling, which most people are probably not going to have. But can we at least get that first knuckle to extend pretty much almost about halfway up? And if we go the same side, you can tell her left is a little more loose. You can appraise this on your own. So you can kind of reach down and grab with your hands and kind of pull up. Again, try to keep that angle of your ankle as best as you can. But if you wanted to feel that on your own, you can kind of do this just to get an appreciation of how much more loose that may be. Then this could direct different things that we can do to try to help to open that up to get more extension here. All right, once we've established our ankle and toe mobility, this is a sample of a combination toe extension and ankle dorsiflexion kind of mobility exercise or stretch that we can do. You can use a yoga block. It can be configured in different positions, but wedged up against a wall or a surface. Again, this is not a balance drill, so you can hold on to whatever you're next to. And the idea is keeping the ball of the foot down. We're going to wedge the toe into extension, primarily at that first knuckle. And then while this is kind of fixated here, Daniela is going to start to bring her knee over the toes to create that combination mobility of the ankle with the toe. General mobility parameters could apply as she's going forward. She can stay there for about 45 seconds and then kind of pull back, doing a couple in a row, comparing and contrast. Couple disclaimers, this is a pretty aggressive stretch on the big toe. So if the toe is sensitive, irritated, annoyed, if we lack a lot of motion here, this might be a little hard to get into. But for those who are just kind of stiff but not irritated, really low pain behavior, it can be a great way to try to get that nice leverage point. Oftentimes that can be greater than trying to pull with our hands to get that same toe extension. And again, moving the ankle forward. This is a generic stretch, but again, things that's going to target lower musculature in the calf, specifically the soleus, because the knee is bent. It is going to affect that hinge joint as well. There are some other videos that we have that look at this too, in terms of mobilizing the joint. But again, to combo the toe and the ankle, this is a great example of something you can do.